Good afternoon, everyone. This is Laverne Miller and Amelia Allen, and we want to thank everyone for joining us on our final Affinity Group webinar until the next contract year. We're enthusiastic about our presenters as well as the subject matter that they'll cover because we believe that it's really timely. The SOAR presentation is really timely given what some of the treatment and other support needs may be of the families as well as the individuals that come through your that are diverted to your assisted outpatient treatment programs, or really that you encounter in any place along the way towards assisted outpatient treatment, because we know that many of you actually are diverting folks. Once someone may agree to treatment voluntarily, or diverting folks out of your AOT, assisted outpatient treatment programs, into services in the community. And we realize quite frequently that income as well as medical insurance is really a barrier in many of your states. Just a few things that we'd like to go over to get started. We are going to read you the disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, which you all know as CMHS, the Substance Abuse Mental Health Services Administration, SAMHSA, or the United States Department of Health and Human Services. Again, there are just a few housekeeping matters that we'd like to go over. Number one, please don't put your phone on hold if another call comes in or you get up to take a break. We don't want to hear your lovely hold music. The other thing is we realize many of you, for a number of reasons, may not be able to speak or join us over the phone for the conference call that you may be watching just in front of your PC, or maybe listening on the phone but not in a position where you can really engage fully. So you'll notice the chat box on your right. What we're going to ask you all to do is identify yourself and the project, the AOT project that you are working with. I'm just going to go briefly over the purpose and objectives. Basically what I'd like to do now is really, again, to recognize our two bang-up presenters, Abby Kirkman and Pam Heine, from the SOAR Center. The SOAR Center, as you all may know, is part of Policy Research Associates in Del Mar, New York. And again, without further ado, I'm going to turn it over to my colleagues, Abby and Pam.
Hi, Laverne. This is Pam Heine. Thanks so much for including SOAR in your last webinar for this fiscal year. We're honored, and we know that the information that we're going to share today is going to help a lot of people. So to get started, as Laverne said, the purpose today is to really share the importance of SSI and SSDI benefits for AOT participants. We're here to show how important it is to connect folks that do not have these very important Social Security benefits, how it can help connect them to that income, the health insurance, and hopefully help people get back to work using the employment supports offered by Social Security, and also connect folks to housing. And also, we want to offer opportunities for AOT grantee staff to get involved with SOAR. So we hope in the Q&A section to really provide some answers to some of your questions and how to go about connecting to the local SOAR, your local SOAR community. So we'll start off with what is SOAR? What does SOAR mean? So we know that SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. And we'll talk a little bit about the two benefits that the Social Security Administration, SSA, administers. And we're talking about, again, helping people with SSI and SSDI, two of the programs that SSA administers that we're assisting people in connecting with. And it is for individuals that you serve who are considered homeless or at risk of homelessness, who have a serious mental illness or co-occurring substance use disorder, which also can co-occur with physical disabilities. And these could be very serious chronic health conditions. So we're not just talking about folks with serious mental illness, but also co-occurring substance use and also co-occurring physical health issues as well. We are sponsored by SAMHSA, and we've been in collaboration with SSA since 2005. And SOAR is in all 50 states at various levels of development, and so we're really excited to be able to connect you to your local SOAR program or your state SOAR program. So just a bit of basics on Social Security disability benefits, for especially folks who are new to this. So when we talk about the two programs, we're talking about supplemental security income. And again, this is for very poor people, low-income individuals, typically folks with little to no work history. And again, it is based on need, so they have to demonstrate that they do meet the income and other criteria to be eligible for SSI. Such as, some of the non-medical criteria like citizenship, living arrangements. So there's a lot that goes into determining whether a person would be categorically eligible for SSI. And again, for this year, the federal benefit rate is $750, so that's not a lot of money. But again, it is crucial to help individuals connect to housing, with this amount of money, especially for folks that do need to contribute a portion of their earned or unearned income to housing. And attached to Social Security in most states is that Medicaid. So that's critical for individuals, especially in some of those non-expansion states, to have access to Medicaid. We're also assisting individuals in applying for Social Security disability and Social Security disability insurance. And again, this is what we would apply for if we should, become disabled. And again, we pay into the Social Security system through FICA taxes. So again, this is typically for individuals who have an earnings record, who have worked, or may be eligible based on, a parent or spouse's work record. So it is connected to earnings. And again, the amount every month kind of depends on, again, what your earnings are, so it varies for everybody. And attached to SSDI benefits is Medicare. So that's really important for folks to understand that health insurance is attached to both of these benefits, but they are different health insurance programs. And again, with SSDI, it is Medicare. And we do have many individuals who are dual eligible for both SSI and SSDI. Again, because their SSDI is very low, that may qualify them for also receiving SSI. So again, we want to be aware of that too. So many people don't know that Social Security has a pretty strict definition of disability. And we're trying to show that the individual is unable to engage in work. And Social Security considers work making $1,180 a month. And that's not a lot, but you are going to be working with folks who are actually working. And the key is to remember, are they working at that SGA level, substantial gainful activity? And again, if it's below that, SSA doesn't consider that to the level of work for them. So again, to show that an individual is eligible for Social Security, they must have a medical impairment or a diagnosis that must be documented, and it must last at least 12 months or expected to last at least 12 months or result in death, right? So there's 3 prongs to the Social Security definition. But it's more than just having a diagnosis. It's how that diagnosis impacts their ability to function. How severe is it? And does it impact their ability to work at that SG level? And this is where the SOAR program really shines, because we train through our online course, which I'll talk about, how to connect the two, how to connect that diagnosis, their impairment, to the severity of their functional limitations and how that impacts their ability to sustain work, right? 5 days a week, 6 to 8 hours a day on a continual basis. So again, it's a pretty strict definition, but again, we are training SOAR case managers on how to, again, paint the picture of that individual. What are their struggles? What are their functional limitations? And how that impacts their ability to really keep a job. So SOAR, as you can see here, we have a picture of a house. SOAR is really just one brick in that foundation towards wellness and recovery. SSDI, we hope, along with income from employment and also that health insurance are really going to, help that person, achieve wellness and the stability that it creates. And again, as you can see, it's really just one piece of that foundation. So we really see that it can really help an individual, again, increase their employment opportunities, and also for folks that are high utilizers of hospitals, emergency rooms, or even, state hospitals and incarceration, that, being connected to these benefits, we have the data to show that that can really decrease these situations for folks. And how do states and communities benefit? Well, we know that when an individual is awarded Social Security benefits, they are able to pay for goods and services through the income that they've earned, that they're eligible for, and also paying for their own health insurance through Medicaid and Medicare. Those are federal dollars, again, through Social Security, that are brought back into the community. So you're not relying necessarily on city and county and state government to fund an individual. So again, it can be really helpful for some of you, some of the AOT grantees who bill Medicaid, that again, health providers can recoup some of that uncompensated care, because again, an individual does have that Medicaid and you can back bill, for 90 days. And again, possibly not paying for some of that expensive public assistance now that the individual has their own, cash benefit through SSI or SSDI. And again, we've tabulated from those states that have reported data to us in 2017. When we add up the cash benefits from SSI and SSDI and the back benefits that a person received, that was over $356 million in 2017. So that's money that, again, that's poured directly back into states and localities. So I'm going to pass it over to Abby, who's going to talk about the SOAR model and really how does it work.
All right, thanks so much, Pam. Yeah, so Pam gave us a great overview of the difference between SSI and SSDI and really the importance of Social Security disability benefits for both the community and for the individual. But now the main question is, how does it work? And we're not going to get into all of the details today. Pam's going to talk about the SOAR online course and how you can become SOAR trained. But we want to give you a brief overview of what makes SOAR stand apart from the quote-unquote usual process. So if I could describe SOAR in one word, that word would be proactive. So the onus of the application process is on the case manager. It's on the case manager who is helping the applicant. We're no longer just sending the applicant down to the Social Security office and saying, okay, go down to Social Security, apply for benefits, and let me know when you get it. Case managers are taking an active role throughout the process in engaging with the applicant, telling their story, collecting medical evidence, developing the case, and then submitting that completed application on the applicant's behalf. Keep in mind that Social Security processes SOAR applications no differently than they do traditional applications. So what makes it stand apart is the completeness of the application. It's not the word SOAR, but it's the effort that's put into it via the SOAR process. So some of the key components of the SOAR process. First, you are going to serve, or the person who is SOAR trained is going to serve as the applicant's SSA 1696 appointed representative. And what this means is that the case manager is able to represent the applicant to Social Security. They are able to apply on the applicant's behalf, talk to Social Security, and most importantly, receive correspondence that Social Security sends to your applicant. Because we all know that Social Security communicates via phone and mailing address. And people who are homeless or at risk of homelessness, they oftentimes do not have a stable mailing address or a stable phone number. We're going to be collecting and submitting all medical records. And through this, we're also going to be writing and submitting a medical summary report. It's important to realize, like Pam said, that it's not just the diagnosis that gets someone approved. Social Security needs to answer the question, why is the applicant not able to work and work up to substantial gainful activity? And medical records alone are not going to tell that story. You'll often hear us say, our job is to paint the picture of the applicant. It's to tell the applicant's story. And that's what you do through collecting the medical records and then writing this medical summary report, which very clearly outlines the applicant's functional limitations and also the struggles that they've had throughout their life and what has led to this point in them needing to apply for benefits. We're going to obtain a co-signature by an acceptable medical source, which will make this medical summary report medical evidence. And we're going to submit quality applications to the local Social Security office. You're going to see later that SOAR isn't just about while it is about the applicant, it's also about building a community initiative, and the local Social Security Administration and then the Disability Determination Services that makes the medical determination is a key part of this. But overall, we want to remind you guys that SOAR-trained case managers are the superheroes in this situation because they are the ones that are in there and really helping the individuals along the way apply for and achieve their benefits. So I mentioned before that it's not just always about the applicant. When we're thinking about beginning a SOAR initiative, we really want to think about who does this individual who is experiencing homelessness or is at risk of homelessness and has severe and persistent mental or physical disabilities, what systems do they touch? And more than likely, it's not just the homeless service system. It could be the courts. They could be a veteran. They could be in a hospital or some type of treatment. They could be in your supportive housing. So when we're thinking about building this community initiative, it's really important to get additional players on board. We don't just want to have one single SOAR case manager and that's who everyone refers to. We really want to build this as a community initiative and figure out how each organization can play a role in this initiative. So to that point, we have developed a SOAR leadership structure, and I want to kind of walk you through the structure so that you know along the way that the case managers and the communities are supported throughout the entire initiative. So on the left, we have the SOAR Technical Assistance Center. This is where Pam and myself work, and each state has a SOAR Technical Assistance Center liaison. So if you are interested after this webinar in talking more about the current status of SOAR in your state or in your community, you would be able to reach out to a SOAR TA Center liaison. And overall, what we do is we facilitate strategic planning meetings, we conduct leadership academies and webinars like this, we have learning communities, and we develop resources such as the SOAR online course, AOT, which we'll talk about a little bit later, and all of the resources you see on the SOARworks website. I really like to say that the SOAR TA Center provides A to Z technical assistance. So you can call me up and say, hey, Abby, I'm having a hard time with this question on the SSA 8000. What does it mean? Or you can call me up and say, I want to start an initiative in my state or in my community. So we really do run the gamut in terms of SOAR technical assistance. Next, we have a state team lead, and nearly all the states have a state team lead. And what they do is they serve as the liaison between the state and the SOAR TA Center and the local communities. So they facilitate statewide steering committees. They work with the SOAR TA Center liaison to help plan and grow SOAR activities around the state. They maintain positive relationships with SSA and DDS, and on a yearly basis, they submit outcomes to the National SOAR TA Center. Now many, but not all communities, but many communities do have SOAR local leads. And these local leads have been trained through the SOAR Leadership Academy, which is held 4 times a year nationwide. And the role of the local lead is to really guide SOAR in their community. They'll facilitate local steering committee meetings, they'll direct local implementations, such as holding SOAR online course cohorts, and ensuring that quality applications are being submitted to the local SSA office. And last but certainly not least, the case managers. This entire structure, you guys are our base, and the entire structure would fall apart without you. So the case managers are really the ones that we want to ensure that you feel supported. They're the ones who are going to become trained in SOAR, and they're going to be submitting high-quality applications and, of course, tracking their outcomes in the AOT system, which we'll talk about a little bit later. So a little bit more about what the SOAR TA Center does and how we can provide support. We manage the SOAR online course, which we're going to talk about in a couple minutes. We also have quarterly SOAR Leadership Academies, which train people on how to become local leads in their communities. We manage the AOT system, the SOAR Online Application Tracking Program, which is where SOAR case managers will track their outcomes. We have a library full of tons of resources, as well as a blog where we share our successes often. We have monthly Soaring Over Lunch calls, which are really free-form calls that you can call into and ask your questions. We have monthly SOAR e-newsletters, and we often hold bi-monthly webinars on a range of topics, and all of which are archived on the SOARworks website if you're interested in going back and listening to those. All right, so we've said all this, so I bet you're dying to know, well, what are the outcomes? How do we know that this actually works? So cumulatively, SOAR has assisted over 40,000 applicants in receiving benefits. And I would say that this is probably a very low or conservative number because there are many people that do the SOAR process but don't necessarily track their outcomes. So this is a message to say if you're doing SOAR, we always want you to track your outcomes so you can be included in this. But over 40,000 people have been helped via the SOAR process to get outcomes. That's 40,000 people who have income, who have been housed hopefully, and who are on the road to recovery, over 40,000 lives that have been changed. Nationally, we have a 64% approval rate in an average of 96 days. And I really want to pause there and have you guys think about this, because I know back when I was a case manager, I would hear that it would take years for someone to get approved. We hear it now. You always hear the myth, you have to be denied 2 or 3 times before you get approved. All of that is inaccurate. It's a myth. You can absolutely be approved on initial application. And if you can imagine someone coming into your doors and you work with them and you submit a SOAR application, and in as little as 3 months, their application is approved and they are on and receiving benefits, that's huge. Yes, SOAR applications do take time in comparison to the usual process. However, the time spent on the front end to do the SOAR applications is not going to be wasted on the back end when you no longer have to work with this applicant for years as they're going through an appeal. So 64% average approval rate in an average of 96 days. Now this is just our average. We also have the top 10 states, and they have an average approval rate of 82% in 96 days. And how they get those numbers is they are ensuring that they are using all the SOAR critical components that you learn about in the SOAR online course. SOAR also assists with appeals. We have an average approval rate of 52% in about 186 days. And I will say this average days to decision with appeals is huge considering how long it typically takes for a person who is in appeal to get to hearings. In my local community of Albany, New York, the average wait time is about 22 months for an appeal. The shortest time I've ever seen is about 9 months, and that's in Rhode Island, and it will vary depending on your location. So with SOAR, do you want to do the application right the first time and likely have them approved in an average of 96 days, or do we want them to be waiting all this time while their appeal processes? So really great numbers that we're seeing. So with that, you guys are probably super stoked and you want to learn how you would become trained. So with that, I'm going to turn it back over to Pam, who's going to tell you how you would go about doing that.
Thanks, Abby. So one of the handout documents that we have for you to download is this Getting Involved with SOAR. And it's a great handout that you can take a look at. It has the SOARworks website, and this is how you would access the SOAR online course. And this is how SOAR case managers are trained in how to submit SOAR applications for the 2 Social Security programs we talked about, SSI and SSDI. And again, Abby shared some of the data that we have, and it shows that the SOAR model does indeed work. So we really do hope that you can identify case managers within your agency that would likely be the folks that would be applying for a benefit such as SSI and SSDI. They may be your eligibility specialists or possibly your outreach workers. And this is something we can help you identify the most appropriate staff at your agency who should take the SOAR online training. We encourage you too, if you're a program director supervisors, take a look at the SOAR online course. Look at Class 1. Again, it gives you a great overview of SOAR. There's some videos, and I think it would really help you, again, be able to bring back more in-depth information about SOAR and how it really should be included in your array of services. So again, the benefits of the SOAR online course are multiple. Again, it's a standardized training. It's provided across all geographic areas. So if you're in one of our more rural states and you may not be able to, get to an in-person training, that being able to access the online course anywhere at any time of the day or night is really important. Again, it is web-based. You can start and stop if you want. You can go through, again, as a guided cohort together. This is something we can talk to you more about as well. But again, it's our standardized training. And SOAR leaders, again, some of those local leads that Abby talked about, can really coordinate follow-up training and support. So, a individual may take that course, but again, we want folks to realize that you're not alone after they finish the course. We want to get them as quickly as possible connected to their local SOAR program. And if there is no local SOAR program, how we can get one started. And again, utilizing the support, the TA support, that available through the TA Center. We want you to utilize us so that we can help, again, start and grow your SOAR program. For many folks out there who are licensed who are social workers, who need to, get credentialed every 2 years, taking the course comes with 20 CEUs, and that can be really enticing for folks who need those credits. And again, this course is free, it's web-based, and again, self-guided, meaning you can start and stop, at any time. And again, we can share with you some great training models on how, again, you can do this with several staff at your agency, or do it, with multiple agencies within your area, whatever works best for you. Again, we can share with you, again, how to take this training and make it successful, where folks are, after the training, are actually submitting SOAR applications. It's just 2 screenshots just to let you know, just so you can see, what the course looks like. It consists of 7 classes and has a great deal of content. One of the unique things about the online course, which differs from, the old training that the SOAR TA Center facilitated, an in-person training that took a couple days, the online course comes with a practice case component. So a caseworker actually gets to submit fictitiously, a practice case by filling out 6 Social Security documents and that MSR that Abby talked about. They get to actually do that, and it gets reviewed by us at the TA Center. We review it, and if the individual passes, that's great. If they need to do some revisions, that's fine too. We give a lot of feedback to help make sure that this application, passes our review. But we know that if it passes our review, this is likely an application that would have been awarded by Social Security, the Social Security Administration. So we really like this, and folks who have taken the online course really do appreciate it, and they learn so much. They're not just passively sitting in a classroom for 2 days. They're taking the online course, so they actually practice filling out forms that are needed for all Social Security cases. And again, based on reviewing medical records, which caseworkers have to do, progress notes. We have video, so you get to actually hear from our fictitious applicant and really understand what is needed to make a winning application. So again, I encourage you to take a look at the SOAR online course and see what it's all about. So I'm going to throw it back to Abby, who's going to talk about outcome tracking and how important that is to sustain your program.
All right, thanks so much, Pam. So now that you're interested in SOAR and you want to have your staff trained or yourself trained in SOAR, Once you've been trained, you'll go on to complete applications. And once you have those approvals or denials, hopefully approvals, it's vital that you track your outcomes. Every year, every summer, actually, the SOAR TA Center collects outcomes. And we hope to have at least some initial outcomes coming out in the next few months. So outcomes are really important for a number of reasons. They're great as supervisors. You can see kind of how your staff is doing. It's also really good for SOAR dedicated positions. Pam mentioned earlier that while 50 states can participate in SOAR, there is no direct funding for them. But if you can show that you have great outcomes and that you are getting people on the road to recovery in a timely manner, that's a big sell for people who may want to fund your initiative. So it's both really important for your agency, the states, and to be a part of the National SOAR TA Center's outcomes. So in order to track your outcomes, we've designed this system called AOT, which is the Online Application Tracking System. It's web-based, it's very user-friendly, it's easy to use, it's HIPAA compliant. We collect no self-identifying information about applicants. Essentially what we want to know about is the decision and how long it took and then some other additional details. This ensures that quality can be monitored, so again, you know what your application is your SOAR case managers are doing. It only takes 3 to 5 minutes to enter each case, so it's not a bear of a system like others that your case managers might historically be used to reporting in. And it's also free, much like the SOAR online course. So there really should not be many barriers to doing this, and the SOAR TA Center can absolutely help train and walk you through AOT once you're ready to submit. I'll also say that we have a pretty snazzy looking dashboard. Now this is a dashboard of our fictitious case manager, Sarah Smith. So you can see the number of pending applications she has here. These are her approval rates, so she's doing pretty awesome. She has a 93% approval rate, an average of 46 days. Now in our fictitious SOAR state of Wyoming, which is not a fictitious state, but for this purposes it is, you can see that her initial approval rate is really doing so much better than the state's approval rate and the national SOAR approval rate. So it promotes a little healthy competition among the SOAR case manager, the state, and the nation. So if we were able to scroll down here, you would see all of her pending applications. And the supervisor and the SOAR caseworker have the ability to run some really neat reports that come out in like donut charts, which can very clearly show the success rate of the SOAR case managers. So this is something that every case manager will get once they enroll in AOT and are ready to track their outcomes. So in terms of next steps, we're kind of reaching the end, and we always like to leave people with clear next steps. We want you to learn a little bit more about SOAR. We want you to visit the SOARworks website, which will be on the next slide. Get in touch with your local SOAR TA Center liaison. One of the documents in the box that we have in the lower right-hand corner is a crosswalk between SOAR local leads in the SOAR TA Center and your AOT grantees. So this document will let you know if you have a local lead in your state, in your community, who your state team lead is and who your liaison is. All of these are also listed on our SOAR TA Center website, so I would encourage you to take a look at that. So once you determine if you have a state, local lead, and we know you have a SOAR TA Center liaison, please feel free to reach out to us. We would love to talk with you more. I know Martha said she's from Ventura. I'm the SOAR TA Center liaison for the state of California, and there is a SOAR initiative in Ventura. Would love to talk with you more about it. And then we want you to register for the SOAR online course. Like Pam said, you can go on and do Class 1 just to become familiar with it, or you can get your case managers ready to go on and complete the online course. Here are some key websites. We have the SOAR website and our online course, AOT, which is what you'll register for after you've completed the training. We've got some disability information on the ssa.gov website, as well as choosework.ssa.gov, which is all about supported employment. So again, we would love it if you would be able to reach out to us. I'm going to put both Pam and my email address in the chat box. So, and they're right there on the, sorry, didn't see it. They're right there on the slide. Please feel free to reach out to us, or you can be in contact with us through Amelia and Laverne. But overall, we would love to talk with you more and really continue the conversation about how we could expand the SOAR initiative. So with that, if you have any questions, I'll turn it back over to...
Hey, great. Pam and Abby, thanks so much for a really wonderful presentation on SOAR, what some of the benefits are, as well as some of the technical assistance support that you all provide as a team to case managers who, well, really to the nation, but most particularly to the case managers that actually sign up for and take the course. So I guess the first question I have is that even if you, I'll have a question, and right now it's really open to the entire audience. If you're on the phone, you can just chime in and ask your question. If you're just on your PC, what you can do is just put your question in the chat box, and we'll ask Amelia and/or Abby, we'll ask Pam and Abby to answer the question. I have a question. Let's say you're in a state that already has a great SOAR program and there's a SOAR lead. Would you still recommend that the AOT program, the case managers for the treatment agencies that the AOT program is contracting with, should take that training?
Absolutely. I think this goes back to when I talked about this being a community initiative. So even if you have a strong initiative in your community, it doesn't mean that the need is being met. And I could almost guarantee you that all of the need is not being met. So in this situation, I would recommend that you reach out to your SOAR TA Center liaison, and we will hook you up with your SOAR local lead. And then they could really talk with you about the current state of the initiative and how you can be folded into it. That's really a best case scenario. You have a community that's up and running, and you can very seamlessly transition into it. So Pam, I don't know if you had anything to add.
Yeah, no, I definitely agree with that. Like Abby said, you want to cast a wide net. You don't want to have one provider in your area, because likely they may not be serving that individual who is receiving AOT services. And so they may look at it as the help that they're looking for to expand SOAR in their community. So I definitely recommend using our crosswalk to see, if there is like SOAR activity in your area. And if you're not connected, like Abby said, go to the SOAR state page, find out who your local leads are or state leads, or, best yet, your SOAR TA Center liaison, because, again, they can give you a lay of the land and really let you know what you need to do to get connected to those folks.
And another question is that, and this is some of the feedback I've gotten from just my colleagues, is that, and I wanted to check in with the two of you, is the idea that basically if you're working, the odds of you, even if you've been diagnosed with a severe mental illness or substance use condition or a co-occurring disorder, that if you do any kind of work, you should quit before you apply.
No, total myth.
Okay,
Yeah.
let's bust that myth.
Okay, so that is a total myth. So first off, we always want to be encouraging people to work, whether they're able to work over that SGA or not. So Pam mentioned that it's substantial gainful activity is really what we're looking for. Is the person able to work over SGA, which is $1,180 a month? And if the applicant can work over that, we want them to keep working, and we want to encourage them to be working. But if they're working under that level, oftentimes work can be a really good indicator to Social Security and in their application, because it's really easy for them, or it can show, yes, they can work up to $1,000, but when they hit that $1,000, they immediately start to decompensate and they're not able to work. So you can put that in your medical summary report, and work can really help with that. So yeah, Pam, I'm sure you can add some things about the work incentives too.
Yeah, no, I think you two really debunk that myth. We want to encourage work, because again, if while an individual is working, that SOAR case manager can approach the employer and talk to the employer about any type of accommodations that they may be making for the individual, and write a letter of support. And we have sample letters of support that we share on our website to really help bolster a case, to show that we allow the individual to take breaks or take a couple of days off from work if they're not doing well. And again, these are things that really show that that individual has difficulty working those, that 5 days a week, 6 to 8 hours a day on a continual basis. And again, we definitely want to encourage work. We know how, again, it can be very helpful to strengthen a case, or also maybe divert that individual from even making an application, because we're showing them that, they're making well above that 1,180, they're working pretty consistently, and let's try to connect you to other work supports that are out there. But again, you could be working and applying for benefits at the same time.
And I'll just add, too, many people don't realize that once someone is on benefits and they are a disability benefits beneficiary, that there are a number of resources that Social Security has to help people get back to work. And there are also many safety nets. Another myth that we often hear is, I can't work over 20 hours, or the second I go back to work, they won't think I'm disabled anymore. So we won't get too much into it today, but that's a part of the SOAR online course, and I really believe that our role as people who know about disability benefits and SOAR case managers is to help debunk these myths. Because in the end, $750 a month is not a lot at all. If someone's able to recover, get health insurance, get housing, we want them to be able to go back to work when they're ready, but also have that safety net be available in case the person does decompensate over time.
Yeah, so I'd like to encourage you all, if folks have questions, again, are there any questions that folks have that are on the phone? Okay. And then as well as the chat box. And I guess what I'll do is I have an additional question. I know one of the challenges is that, particularly around understanding, because I would imagine that many of the individuals on the AOT programs, maybe young adults or transition age youth, or folks that are under 35, let's say, who and one of the things that, the evidence shows that employment is a really important part of the recovery process. As Abby said, it's about income, it's about the other sorts of benefits that indeed Social Security, having both having the cash benefit as well as the medical benefit, the insurance benefit, how important that is to not only reach, starting on the journey of recovery, but also maintaining your recovery. So I have a few questions about those workforce incentives. Can you talk a little bit about the rapid reinstatement? Because one of the things I can imagine is there are a cohort of young adults that you all are working with who you really want to encourage to eventually transition to employment once they've actually maybe attended a training program, benefited from other state vocational rehabilitation services, that having the SSI, SSDI determination really puts them to the front of the, front of the line in terms of receiving other kinds of benefits. So can you talk about that rapid reinstatement, Pam?
Mm-hmm. Well, it's certainly one of Social Security's work incentives, and it's one of the best ones, that, expedited reinstatement of benefits. And I think the more knowledge and information we can give to Social Security beneficiaries, particularly younger people, that, we want to make sure that they understand that should they, they need to take a break from work as a result of symptoms, that there is a way for folks to get back onto their benefits. And it takes a long time for somebody to get to that point as well. And again, our course, Class 7, provides a lot of information on work incentives. And again, sharing that information with folks who may not want to apply for benefits because of that fear, to show them that these, work incentives are out there, and the SOAR caseworker, or if, once a person is receiving Social Security benefits, gets handed off to maybe a eligibility, like a benefit specialist who really understands the ins and outs of work incentives. And that's the goal, is to connect folks to benefit specialists as quickly as possible, so that they can really make it understandable to that individual. Again, how to track their monthly income, ways to do that so that they don't face overpayments, right? Because you're talking about people that will likely go back into the workforce, and they want to, again, like a SOAR case manager who helps them with their benefits, there will be somebody else who specializes in Social Security's work incentives in their community that they want to make sure that that individual, again, is armed with the information so that they know this is what you do if you have to step away from work due to your disability, and this is what you need to talk to Social Security about to be able to get your benefits reinstated. Again, Class 7 does go into detail on that particular work incentive, too. I hope I answered your question.
You did, Pam. You did a total 180 discussion around, degree discussion around particularly that workforce incentive. There are a few things I'd like to just bring to folks' attention is around Medicaid buy-in programs. A lot of times you'll be working with hopefully individuals that, on temporarily on SSI or SSDI. At some point they transition to what we call substantial gainful activity, competitive employment. And the question then becomes, as we all know, that, I don't want to lose my Medicaid benefit, the insurance. It's better than any employer or commercial insurance that I'd be able to get on my own. And so for many of your states, and this is the tricky part, is that they have established Medicaid buy-in programs where essentially an individual pays a premium to based on income to maintain the Medicaid benefit. Here's the rub, is that the states struggle with how to administer the Medicaid buy-in programs. Some states, in some ways it's worked as a benefit because most states have yet to figure out what the insurance premium on an annual basis should be. So many times in many states that actually have buy-in programs, it's really just applying for and being, accepted into the buy-in program, and often there's no premium at this stage of the game for people to pay. But again, it's really important to your state Medicaid office or other kind resources should be able to, folks that are familiar with the Medicaid buy-in program should be able to really talk about what the process is in your individual states. The other thing that I wanted to bring to your attention is that all of your states have benefits advisors. Either they're funded through your state vocational rehabilitation state agency. That's the state agency that provides generally gets most of their funding from the Federal Department of Education, and really provides a wide range of services, whether it's around education, training, helping individuals purchase clothing and other kinds of things that are necessary for the person to obtain the job. But some of the other things that they provide, your state VR agencies, and I'll talk about that in a minute, but so they actually have, on-site benefits advisors that can really, as Pam said, have the expertise to go through several different scenarios to really make sure that individuals in your AOT program, as well as their family members who may have an interest, understand what the consequences will be around employment and around depending upon what kind of income they make. There are also, all of you are in counties where there are what we call supported employment programs. Supported employment is really an evidence-based program, recognized as probably the best employment program, has the best statistics around getting folks with a severe mental illness, and evidence is shown as well with the substance use history back to competitive employment in the community. And those supported employment programs all have, most have dedicated employment specialists as well as benefits advisors who can at least run you and your staff through, again, provide the same kind of technical assistance and support around workforce incentives. Here's the downside of it, and this is what we tell everyone. There are never enough benefits advisors in any state. So one of the things as you're thinking about your AOT program and your interest in building capacity around benefits advisement is to really think about, is there is there a way that, other members of your team can go through the different training programs, whether it's the Cornell training program or others, around becoming a certified benefits advisors? And I just want to put a plug in for your peer staff that often admit what we see, particularly in some pilot programs that SAMHSA's funded around supported employment, is that peer staff often are really good candidates to go through the benefits advisement training, and that's an additional skill set that they can acquire and really sit down and allay folks' fears about what the impact of employment will have on either the cash benefit and or the insurance.
Yeah, and I think that really speaks to having a community initiative, a wraparound initiative, because yes, while we're here talking about getting people on benefits, once that has happened, you really need to be able to provide a warm handoff to other people in the community, whether it be housing providers or other case management, or it is someone to help them manage their benefits.
Yeah, and one of the things, I was going to say one of the things we do at the SOAR TA Center is create a lot of products and tools. And if you check the SOAR website and click employment, you're going to find some great tools, employment resources for that, SOAR beneficiary. So how to think about some of these issues. And when we talk to case managers who are going through the online course, we encourage folks during that initial engagement process, in the beginning when you're interviewing folks, is talk about employment at the get-go. Don't wait until after you've submitted the application or after a decision. You want to make sure those conversations happen at the very beginning, and you may include your vocational unit there, right, the case manager, and really work together. And SOAR, we've done a pilot on integrating this, and we have some great documentation on how to do that. So again, I wanted to kind of throw it out there to get on our SOAR website, check on our employment, some of our employment products. So we have some great resources there as well. Amelia?
Sure, thanks, Pam. I just had a question, because as you were talking about overpayments, it kind of reminded me, I also used to be a case manager, and that used to be a big problem with the parents. SSA out of nowhere would be like, well, we overpaid you, so we're taking this much from you, and it would really, mess up their month, where then they would have to take money from wherever their budget was. Kid couldn't get their T-shirt that they want, whatever it was. Is there a way that you guys monitor and have a way to avoid that sort of overpayment issue?
So it's part of our SOAR online course that we talk about overpayments, and we will talk about the reason why overpayments occur. So they might occur because there's been a change in living arrangements, or there was work done that was not reported. So we really talk about, ways to avoid overpayments, and educating the case manager and really the parents too about how to avoid them. But we also talk about, if there is an overpayment, how you can help remedy that. So you as a SOAR trained case manager could definitely help them try to either waive the overpayments or get them taken down so that it doesn't make as much of an impact on monthly payments.
And those are deductions for expenses and other kinds of things that would not have otherwise, that were new and would not have otherwise been calculated in the initial application award. Okay.
Mm-hmm. Yeah.
Right.
Yep, we definitely have information on that on the SOAR online course. As you know, often it's not the beneficiary's fault at all. They weren't aware of it. So there's a way, like Abby said, to waive it, and by showing that it wasn't their fault, that we can do that too. But again, love to direct you to the online course for that. And if anyone has those issues, to contact us at the TA Center so we can help out.
Yeah, and I just have a question about trends, because I know you all follow trends, around housing and other kinds of benefits. Is it your understanding that increasingly, whether we're talking about supported housing with sort of a minimum amount of clinical services, well, you're not required to have clinical services as a condition of housing, or supportive housing where there's where where there are wraparound services provided on site? Are you all increasingly finding that there's, that that it's easier to train, for folks to obtain that kind of housing with having the SSI, SSDI benefit?
Yeah, I think overall we're kind of seeing that. I mean, people don't love zero-income applicants. You want to be able to pay a portion of your rent to that. However, we are always advocating for communities that do use that housing first model to house individuals. But what we have often seen is that SOAR is a component of those programs. So if you have people living in your permanent supportive housing, housing first programs, or shelter plus care, whatever it is, they are adopting the SOAR model, those case managers are, and the time that it takes for applications to be processed is much shorter because people are living there, they have access to them. And with that, they're able, once they are awarded benefits, they're able to pay a portion towards their rent, whether it be that 30% or whatnot, which is able to then sustain the program.
Great.
And also I'll just add on, being deemed disabled by the Social Security Administration does open up housing for individuals, again, who can show, I am disabled under Social Security's rules, so it might open up housing in senior disabled housing units and things like that. So that can be really helpful.
Thanks. So I don't see that we have any questions. What I'd like to do is just give Pam and Abby an opportunity to make some closing remarks before we close our call today.
Yeah, I'll just say thank you, Laverne and Amelia, for having us again to close out your webinar series for this year. And again, just encourage you to reach out to both Abby and I, or find your state on the SOAR website, and feel free to reach out to your liaison that will be listed there, who would love to have a chat with you and see how we can connect you to some SOAR training and to the wider SOAR community, hopefully in your area.
Yep. Abby? I'll just echo Pam and my thanks, and we really do look forward to hearing from many of you. We're always looking for opportunities to expand SOAR initiatives in areas that have strong SOAR initiatives and those who don't. So please feel free to reach out, and I think that SOAR could really dovetail well into the AOT initiative.
Thank you very much. I thoroughly enjoyed this webinar. There's some great information, but most importantly, there's some resources, expertise that lies within our SOAR program that we really want to encourage you to take advantage of. As Abby said earlier, you're not alone. And one of the most challenging aspects of case management is feeling alone and really having to feel as if you're not supported and have to reinvent the wheel and don't have a safe place to land where any questions that you have can be answered, whatever support that you need can be provided. It's with mixed feelings that we say this is the last Affinity group call or webinar for the contract year. Our new contract begins in early September, and we'll have a better idea within the next few weeks about a number of things. Number one, around when we're going to have our kickoff meeting. Number two, the amount, not only just the quantity, but the kinds of technical assistance that we'll be able to provide the AOT program through different vehicles, whether we're talking about the affinity groups and or the on-site TA or other tele-TA or other kinds of models that we'll be using. We want to encourage all of you to really take this time, whether this is your first or second time on the affinity groups, and we had a really good showing today, or you've been a member, is to take a few days or a week or so and really, and particularly engage your team and other members of your affinity group and really thinking about what is it that you would like us to do differently in terms of our management style and the way we've approached providing TA, peer-to-peer TA on the affinity group calls. For example, we've gotten some feedback that while something like the SOAR presentation lends itself to a webinar, that folks often enjoy us sort of mixing it up, like a mixed ice cream cone, different kinds of flavors. Your taste buds get a little bit more excited than just having one flavor. So really thinking, wow, I don't know why.
We are many, Laverne, SOAR is many flavors.
It's many flavors, rainbow sprinkles. But really to think very deeply about, what are there subject matter areas that we haven't covered? Or are there things that you're really interested in, things that have come up during the course of your work? For example, there are two areas that we've already identified based upon feedback we've gotten from some vocal members. We're organizing a webinar probably in late October on advanced directives or healthcare proxies, a way in which folks who are in your AOT programs, once they're stabilized, can then be engaged with them and as well as their family, if they're interested in really planning for crises, planning for what kinds of support and services work and what they'd like to see have to be made available. We're also working on a webinar probably in early November focusing on collaborating effectively with inpatient psychiatrists. We realize that some of you are admitting folks from directly from your state hospitals and some of your acute care hospitals directly into the AOT program, provided that they fit the criteria for admission. So, just think about what can we do differently, both in terms of how we manage it, how we deliver it, but also in terms of the subject matter. And that will help guide my right hand and my left hand, Amelia and I, at least until Ashley gets back. I don't know how many of you know, but Ashley did have the baby, and she had a bouncing big baby boy. But at least in the short term, Amelia's going to be working with me as I do planning for the next year. And you all drive that process. Neither Amelia nor I have any idea directly about what you're really dealing with on the ground. So really, I really want to encourage you all to really be active participants as we begin to plan for the next contract year. So enjoy the rest of your summer. We won't be inundating you with reminders or emails. Well, we'll be getting a few emails, but not as many reminders. And I want to thank you all for the hard work that you do. You all are, really pioneers in many ways. But the hard work that you do and the difference that all of you want to make in your communities. Take care and have a good rest of summer. Yeah. Take care.
Thank you. Bye, Pam.
Bye.
Bye-bye. Yeah.